After the recent census report, the Uganda Bureau of Statistics reported that the people with disabilities make up 5.7% of the total population. However, disability rights groups including the National Union of Disabled Persons of Uganda rejected this figure, stating that the figure is much higher than the 12.4% recorded in 2014. The Minister of State for Disability Affairs requested UBOS to provide further assessment for a clear report. She addressed this during a media briefing at Uganda Media Center.
Almost everybody is contesting the results of UBOS. I told you in 2014 they gave us 12.4. So what they were reporting was not the same with ours. That's why we have requested them to carry out a special UBOS assessment on people with disabilities, looking at the different functionalities. Because our request as a ministry is to know how many people are physical, how many are deaf, how many are blind, how many are whatever. Because you can't think disabled people can be put into one group.
She stated that the Bureau apologized for the miscalculation and promised to give a final statement in December.
As we all know, UBOS has promised to give a final statement in December. That's when they will now release their results. And we're under discussion. They have given the apology, and I think we're waiting for the results. That's why you see I'm still quoting the previous census report.
The minister also provided an update on the progress made towards improving the well-being of people with disabilities, highlighting efforts to ensure inclusivity in areas such as household incomes and education, among others.
In the area of economic empowerment, there is enhanced government support towards economic empowerment programs of persons with disabilities to ensure improvement in household incomes for persons with disabilities. The government has also 5 vocational rehabilitation centers spread around the country and 1 sheltered workshop for persons with disabilities geared towards providing specialized hands-on training in specific trades for youth with disabilities who are unable to continue with formal education. In terms of health and disability inclusion, Ministry of Health staffing structure now caters for sign language interpreters up to Health Center 3. To enhance medical rehabilitation, surgeries for children with disabling conditions have been expanded from Mulago to include at all regional referral hospitals.
Despite the ongoing efforts to promote inclusivity for people with disabilities, poverty and inequality remain high among them, highlighting the need for further improvement in their well-being. She identified several key areas that the government needs to prioritize.
This government is focusing on the following areas to improve the well-being of persons with disabilities. Scale up mobilization for persons with disabilities to enhance access to the PDM by persons with disabilities from the 2% to at least 5% out of the targeted 10%. We would like to revive the orthopedic workshops in all the regional hospitals in Uganda to facilitate affordability of rehabilitation services and assistive devices such as wheelchairs and glasses. Under NDP4, prioritize disability inclusion across the 18 program areas to mitigate the previous low performance which was highlighted in NDP3 during the midterm review. We also plan to design the Child Disability Grant targeting children with severe disabilities to support households with the additional cost associated with caring for these children.
In accordance with this, Uganda is set to join the global community in commemorating the International Day of Persons with Disabilities on December the 3rd. The celebration will take place in Kumi District, Eastern Uganda, under the theme Improved Household Incomes for the Well-being of Persons with Disabilities. Hope Nyongereza, Church of Uganda Family TV, News at 8.